Hi, everyone. Thank you for joining us for COVID Conversations. And so we're about to start the second session in the first part of the symposium. But before we do that, I would like to begin with land acknowledgement and also the recognition that in this global year, the UN has declared it the Year of People of African Descent. And so that's to highlight the themes of development, justice, and recognition are the three key themes. And so in light of that, we'd also like to recognize the continent and the diaspora that comes therefore. As we move now into the land acknowledgement, I'd like everybody to take a minute and just take a breath. Good morning. So we'd like to start by acknowledging the land on which we are gathered today, and by acknowledging the caretakers of this land. This land is the territory of the Mississaugas of the New Credit, and the ancestral traditional lands of the Anishinaabe, Haudenosaunee, Ojibwe, Chippewa, and Huron-Wendat nations. As we think through relationships, it's critical that we also acknowledge Canada's settler history and present and our own positions within that. And so for us here, land acknowledgements are an opportunity to reflect on what are the relationships we should be thinking about and thinking through in relation to Indigenous peoples, First Nations, Métis, Inuit. And so I hope you carry that through the session and throughout your day. And I'd also like to take a moment of recognition and to do that through a moment of silence. There are some major concerning issues that are happening here in Toronto, Ontario, Canada, and three things need to be recognized in this moment. And there are so many more, but for now it's three, and we're going to take three separate moments of silence. And the first one is for Regis Korinsky Paquette, who came to an untimely death in the presence of police. Her family is deeply aggrieved, and we take this moment of silence in recognition of her and her family's loss, and our loss, because the greater world is a composition of all of us, and she's now no longer with us. And that there should be justice in this instance when there has not been in so many others. And so I ask you to just close your eyes and bow your head for a moment of silence for Regis. And now I would like us to take a moment of silence for many of the Black frontline workers, the seen and the unseen, the nurses, the PSWs, the docs, the domestic workers, the live-in care providers, who have lost their lives and who have at times been maybe not as deeply as appreciated as they should be, as we talk about this theme of essential workers, and somehow Black workers go missing until they die. And so in this moment, I would like us to close our eyes and take a moment of silence and recognition for the Black frontline workers, the seen and the unseen, doing the work that keeps cities, countries, and nations running, that is often underpaid, undervalued, with little labor supports. And the third and final silence is in recognition of the global struggle for justice and fair living conditions, to live unthreatened, to live with peace, and to be recognized by the Constitution fully in all moments. So we stand in this moment of silence and solidarity with our brothers and sisters south of the border in Minneapolis, but actually also all around the world, because the media chooses to acknowledge what is and what is not happening, but we know all around the world that Black people struggle to maintain control over their Indigenous nations, states, over their space and their personal opportunity to live in constitutional democracies and beyond. And so we've seen through COVID around the world where Black folks have been singled out and victimized. So we recognize all those intersections in this moment of silence. And now I'd like to move into the program. And so in COVID Conversations, we're We're here to have a conversation about some of the broader opportunities to think through what's happening in this moment of the pandemic. And so there are three individuals that we're going to be in conversation with this morning. And the one individual we're going to introduce first is Ruth Cameron, and I'm going to read you a little bit of her bio. Ruth Cameron is a Black lesbian advocate and researcher. She is the executive director of the AIDS Committee of Cambridge and Kitchener-Waterloo and area, also referred to as ACWA. She is a doctoral student. Ms. Cameron is the co-chair of the Harm Reduction Coordinating Committee for the region of Waterloo Public Health and a steering committee member of the Waterloo Region Integrated Drug Strategy and for the African Caribbean and Black Network of Waterloo Region. Ruth, can you tell us just a little bit more about yourself?
Thank you so much, Lana, and greetings to everyone who is online and part of our conversation today. Thank you so much for making time on your Saturday and being here. To introduce myself a little bit more, I would say that I am someone who comes to this work from a social location and lived experience. As you had mentioned, a Black lesbian mother warrior, child of the diaspora with Jamaican roots, someone who comes to this work both from an academic and a frontline perspective as someone who has worked in nonprofits, who has done community-based research, and has now been doing Black LGBT health and HIV/AIDS work for a period of time. Other things that I think are important in terms of how I ground myself in my analytic and in my praxis are as someone who comes from a working class background and always remembers that class is also raised in this location where we are now today.
Thank you very much, Ruth. I'm now going to introduce Dane Record. Dane Record is the manager of education at the AIDS Committee of Durham Region. Since 2015, he has been active in amplifying the importance of Black health and agricultural work through the Durham Region Migrant Workers Network, a collective of service providers, researchers, and volunteers. Dane, good morning.
Hi, good morning, and good morning everybody who's online, and also a greetings to those who receive these messages and these words who are inside. Just want to say hello, good morning, and we're all with you out here. To all of you inside, just do what you gotta, do what you need to, stay alive, but just keep your distance, stay safe, and we'll see you on the other side over here. Just back to the intro. Volunteer for 10 years, a little over 10 years in this work. My layers of identity is always going to start with my Blackness. I'm a Black man. Identities will unravel along the way, but what folks are going to see all the time is my Blackness and my Black health, and they're always going to see Black people work coming first. The work is always going to be rooted in the culture, in the community, and I will never call myself an expert. My tenure is not yours, if we put it that way, but my experience will certainly glean from the experience and the meaningful involvement of everybody involved.
Wonderful, thank you. And our next individual that will be joining the conversation is Alexander McClelland. Alexander, good morning. Good morning. Hi.
Nice to see you.
Nice to see you. Alexander McClelland is a sociologist, researcher, and a Banting postdoctoral fellow at the University of Ottawa and the Department of Criminology. He is currently examining issues of confidentiality for research with criminalized people. His work focuses on the interactions of life, law, and dis-ease, where he has developed a range of collaborative and interdisciplinary writing, academic, activist, and artistic projects to address the issues of criminalization, sexual autonomy, surveillance, drug liberation, and the construction of knowledge on HIV. Alexander is a current member of the Canadian Coalition to Reform HIV Criminalization.
Thanks for having me, Lana. And thanks. Also, it's an honor to be here with Ruth and with Dane. I'm coming to you from the traditional and still unceded territories of the Algonquin Nation, which is known by some people as Ottawa. And I'm a first-generation settler from England and a fifth-generation settler from Scotland and Ireland. And for those of you who don't know me, I come to this work primarily as an AIDS activist, as someone who's living with HIV. I study now law and society and the policing of communicable disease, specifically from the perspective of criminalized people and those of us living with communicable diseases. And so my interest is looking at the consequences of criminalization, and namely the forms of violence that target specific communities, specifically people that was living with HIV. Yeah, I look forward to our discussion today.
Okay, so on that note, we're going to jump right in. So with the first question, I'm going to ask you, Ruth, are we, and this is when I say we, I'm talking about Black folks, because the symposium, we're centering Black life, and we welcome everyone who's not Black to listen, because we don't create or construct the anti-Black racist experience that we're having. And so we need everybody to be present. So in this question, I'm asking, are we all asking for the same thing when we ask for race-based data? And yesterday in that session, when we were talking to Lynn Jones and David Austin and Ronaldo Walcott, we offered them that question to share their thoughts. So please do share your thoughts around, are we all talking about the same thing when folks ask for race-based data?
I would say that we are not. So I think that I will try and describe really briefly what I saw as a phenomenon with regards to the most recent call for race-based data. So what I saw happen was, as an individual who is part of the steering committee of the African Caribbean Black Network of Waterloo Region, first off, a question in media around, yet again, a call for race-based data and disaggregated data, which was taken up by different groups in the community in different ways. And I want to be incredibly cognizant of the conversation that was held yesterday, because I agree with all of the participants that if we're talking about racism, not in the naive Canadian sense as individual interactions, but as living in the wake of the transatlantic slave trade and racial capitalism and settler colonialism, racist systems cannot collect data and not do it in ways that aren't racist unless they are explicitly anti-racist. What I saw happen on the ground was a number of different groups call for the collection of race-based data. The ACB network started a petition where we called for the collection of not only race-based data, but disaggregated data, because our communities are not a monolith. We do not assume that Blackness is experienced the same by everyone who identifies as Black. However, in media, our call was simplified and flattened to a call only for race-based data, though we had explicitly asked for disaggregated data. As well, what I noticed was that some of the community calls across the province were superseded by calls by individuals with more prominence, who either were within the Black community, but not necessarily connected to the grassroots, or individuals who were acting on behalf of more marginalized, including Black communities. Mm-hmm. So that's something that I observed. So I don't think that all of those constituents are asking for the same thing. This is where naivete would come in, where some individuals think the collection of data in and of itself is evidence of change, something that I would not say that the ACB network and those that I work with hold to be true.
Well, Ruth, I want to say thank you for that. I think that that provides another perspective, because, you know, I'm picking up when you said that some more prominent agencies or profiles were taken up, while those that had more detailed and nuance were not only not taken up, but also flattened. So I'd like to ask Dane next. Again, the same piece. Do you think that when Black people are asking for race-based data, that they're all asking for the same thing?
Depends on the audience and the ears receiving, because here in Canada, in Toronto, in the greater area, and in North America, where Black people, in Ontario specifically, where Black people are making up less than 5% of the population, but being accounted for a little under a quarter of those living with HIV. We're not asking for the same thing. We're certainly not addressing some of the important matters that people are still hungry. People still need to pay rent. People just need a roof over their heads to have some optimal health, and to continue to ask for the same things, and to celebrate a lot of work that happened before, dust it off and call it a celebration. We are still forgetting those on the margins, or those pushed to the margins. So depending on who is being asked and who's getting the airtime, that's what the mass is going to receive. But those of us on the ground, when we ask, we're going to need to do and continue to do some serious back channeling to get that data and make it move from profiteering to production, because there is no way that people living with HIV should be hungry. People working on the farms should be limited in their movements. There shouldn't be any sort of transit concerns. Yet we have a public transit system that doesn't work with and for everybody, particularly the essential workers, those that look like us that need to get to do the work that needs to be done. We're not asking some of the hard and critical questions. But hopefully with the data collection, that actually has been collected in a number of different ways for a number of years. But if we're asking about it in a more mainstream sense, maybe we can put some application to the numbers.
Okay. So I want to hold it right here. I'm just going to go back to what Ruth, some of the things that you said and some of the things you said, Dane, and then we're going to move into a question for Alex. And so in relation to the way in which the race-based data call is taken up by different groups, can you get into a little bit more of that so that folks can understand what you mean? Because you're talking about, Waterloo Region. In the beginning of this call, we see it coming out primarily from Toronto, but there's a sequence of events that need to be clarified, I think, that you were offering us, and an amplification issue.
Yes. So something that I would state is that there were multiple petitions that started around the same time. Some of the groups that the network reached out to, rather than amplify the petition that was started at the grassroots, went forward with their own, which were more prominent and did gain more traction in terms of being amplified across the province. Regardless of that, I think that your question around, what are different groups asking for in terms of data, what the grassroots was asking for was an accounting. Yes, I take it very seriously, the fact that we've collected data in the past and failed to act on it, and that racist systems are going to treat additional data in racist ways. I absolutely acknowledge that is true. What individuals were asking for was for the Canadian state and public health authorities to acknowledge that the same disparities, despite our so-called universal healthcare system, exist for racialized groups, for communities who are disadvantaged by queer phobia, by AIDS phobia, for migrant workers that exist in the United States. We always maintain our innocence through looking south of the border when it comes to the responses from to requests from communities that are at the margins. So the call was a call for some accountability. The fact that our local Department of Public Health said collecting that data wasn't a priority is something that then the grassroots can work with, right? That they said that with their chest is something we can work with them in terms of how we go forward in terms of organizing to protect our communities.
So we have a question here, and the question is, what's the difference between race-based data and disaggregated data in the way that you're speaking about it now?
I'm talking about all of our communities and all of our complexities, right? So not only thinking of people who are Black or individuals who are Indigenous or POC as being racialized, but thinking of white people as also being racialized in a very divergent way. Thinking about the complexity within our communities, and that I am not only a Black woman, but I am a Black woman who's considered to be middle class, yet I suffer from queer phobia because I'm a lesbian. That probably has impacts with regards to health outcomes for me. So I want to be, if data systems are going to take me into account, I want them to take me into account in my full complexity.
And so are you suggesting that you want the state to do that accounting for you?
I'm suggesting, and something that I'm hopping way ahead here, I will coin what you have taught me as data sovereignty. Mm. So what I want is for my local health unit to be able to account for the disparities that are happening within a region that is not considered to be highly racialized, but where I know that disparities do exist for those who are considered racial minorities, for lack of a better term right now off the hop. I want them to then have to put forward a public health response that speaks to equity in putting extra resources to ensure the safety of the more marginal constellations of identities within the region.
Okay, and so that does kind of speak to what came up in the earlier session yesterday, the idea that who gets to decide and initiate and manage that process are the individuals who should be at the center of it, like not those who are examining it, and it sounds like you're also concurring with that. And it's not just simply a call for the state to amass more data in institutions that we know are engaged in surveillance, which is a question that we're going to come to further down. And so now I'm just going to, there was a piece here I wanted to ask, moving just kind of forward. We're going to come back to this piece again, to Alex. And I wanted to ask you a question to kind of bring these two thoughts together around the piece around the two pandemics being vastly different, but yet they are both pandemics. And in the early stages, the same kinds of questions swirled, right? And so people might think now, oh, we know exactly what HIV is. We know what those conditions consist of. But in the early days, nobody knew what it was. They didn't know how it moved. It just seemed like a set of experiences happening in different locales that had to be pulled together. And so I want you to, if you can please help us enter into answering the question around the two pandemics are vastly different, but based on your work and your research and your lived experience, what echoes of the HIV pandemic are you seeing in the COVID-19 pandemic?
Thanks for that, Lana. Well, I focus on criminalization and policing of communicable disease. So the echoes I see are response ineffective and unequal and unjust patterns of enforcement that emerge in the context of a panic that arises around a pandemic. And so HIV, Canada is a leading country in the world for criminalizing people living with HIV under certain circumstances. This is a phenomenon that is highly patterned by race, highly racialized, highly gendered. It disproportionately targets Black men, Indigenous people, women, and queers. And this happens in a couple of different ways in Canada. We mobilize criminal laws to primarily punish people for alleged wrongdoing in relation to not telling someone else they have HIV. This is not about the transmission of disease at all. So people are punished for just not telling someone else. We use aggravated sexual assault, one of the highest charges in the criminal code, to respond to this, with up to a lifetime sentence and a mandatory registration as a sex offender. And in this context, I've done research for my PhD, primarily because of, as someone living with HIV, having personal experience of having friends who are criminalized, and being really concerned about how the sense of insecurity and unsafety that responds when you're a target of criminalization, which people of color know very intimately and deeply about. And so when talking to people who had lived experience of criminalization, which is what my work is focused on, Black and Indigenous people faced heightened forms of extreme physical violence when criminalized in the context of using criminal law. We also mobilize public health laws to respond to communicable disease. So HIV is classified as a reportable communicable disease, so is COVID. And so when someone is allegedly doing something that could be perceived to put others at risk of transmission, you can have legal orders mandated against you from medical officers of health, which mandate specific behavior, counseling, treatment in relation to HIV, mandated condom use. And those can be followed by criminal proceedings if you don't follow through on the public health. We also see all forms of a context of broader criminalization that people face, and criminalization of poverty and criminalization of queerness and Blackness as well in the context of this. So the people are facing like integrated forms of criminalization. One of the other things that I think around communicable disease that I think is a concern is that police, when deputized with the power to enforce communicable disease, can use communicable disease as a justification for the use of force or the justification for the use of violence. So we seen this a number of times, but we saw this in 2017 when Toronto Police Services tasered a Black man and pushed his face down in the asphalt and said to onlookers, he's going to spit on you, you might get AIDS from him. And obviously it's impossible to transmit HIV from saliva, but here we see police using the fear of HIV to justify the use of force. And I think that that's a kind of fear that I'm concerned will happen with COVID. But those are a few of my concerns.
Okay, and I would like to ask Ruth to come into this question. Can you give us your thoughts on, given your work, your experience professionally and personally, what echoes of the HIV pandemic are you seeing in the COVID-19 pandemic?
Some things that I am seeing are a desire to assign blame for vulnerability to poor health outcomes through the lens of HIV, through the lens of COVID-19, to disproportionately marginalized, racialized communities, to poor and impoverished communities. I think about the story of COVID through how we're now emphasizing geography as COVID has moved into populations of, and now we're mapping it by postal code. Now that it's moved into racialized communities, that it's disproportionately affecting Black communities, we're talking about geography. But we didn't talk about geography when COVID first popped up in the United States, where epidemiologists and health geographers have traced it as coming from Europe. So therefore, coming from affluent people who were in Europe and then returned to the United States and seeded COVID in the United States. We didn't talk about geography there and map that, and we haven't emphasized that in media reporting. We again haven't emphasized affluent white Canadians going on their March break, us not curtailing people's movement prior to March break and saying, don't go on March break in Florida, go bring back COVID. We didn't emphasize geography by heavily policing the white Canadians returning after March break. We told them, hey, could you do us a solid maybe and go home and self-isolate for 14 days, but that was in no way enforced. Those individuals probably stopped at Sobeys to get some groceries on the way home, creating vulnerability for the essential workers there, and then may or may not have decided to self-isolate for 14 days. After COVID moved from those populations to more vulnerable populations, conversations about contact tracing started that would use technology and apps. We aren't talking about using technology and apps for the affluent people who've now decided to go to cottage country for the weekend and might be passing through vulnerable First Nations on their way to their cottage. I see this as being incredibly reminiscent of HIV.
Okay.
I think about the fact that there were talks about quarantine on islands at the beginning of the HIV epidemic, things that we don't talk about in HIV history. The fact that there was a travel ban to the United States, things that we don't emphasize and reify in our retelling of HIV history, and the fact that Canada did not fight that. Canada was passive on that. So geography and HIV, I think about it through those lenses, and I haven't even talked about the so-called global North and South yet.
Okay, so we're going to come back to that. But I want to, just before we move on, I wanted to decode. So you did a code switch and you used the word vulnerability. And so often in public health and epidemiology, vulnerability as a word is used to describe something without describing how that thing came to be. And so often the word vulnerability is embodied by a racial identity or a sexual identity. Here, are you meaning the same thing, or are you looking at the more critical use of the word vulnerability, where it's seated in recognizing it as a code switch away from describing the structural analysis and into a more, if you will, special interest or politicized analysis, which makes it apolitical and ahistorical?
Yeah.
Can you clarify for me?
To be honest with you, because I was speaking so fast, I didn't want to say vulnerabilized because I knew I would stumble over it,
Okay.
which is what I really did want to say. So thank you for the opportunity to clarify that. And I wanted to get a lot out in a short period of time. And I very much, in the way that I think about those as communities made vulnerable through failure. There was a report that I always think of because of its name, a report done by Queer Ontario called Systems Failure back in the 90s. There I'm showing my age. And I always think about that title, Systems Failure, when I think about these types of issues.
And so the system being, are you talking about the state, federal, provincial, municipal system? Yes.
Yeah. I think about that, and I think about all of the resources that have been siphoned off from our public health response.
Okay, so I'm going to hold you there, and I'm going to move now to Dane. So just to refresh, the two pandemics are vastly different, but based on your work, your research, and your lived experience, what echoes of the HIV pandemic are you seeing in the COVID-19 pandemic?
Syphilis, chlamydia, gonorrhea, and HIV are all reportable. COVID is reportable and going to be reportable. You combine COVID with any of the reportable communicable diseases, and call it what it is. Arrests will happen. The apps, the social media apps for hooking up and getting together, even if it's for a coffee or for a coffee, those apps are being policed. And for those thinking that that's not happening, if any researcher connected to a Politico wants to offer up a number of figures that are going to boost the value and the spread of that app, best believe that your postal code and your GPS location is going to have some police coming to your door. So what I see happening now, and what we talk about in the work happening now, comparing to the early when in the epidemic, people were hooking up in private, or if we're going to mainstream it and talk about bathhouse raids and such, it's just an easier, more hidden and covert way of policing the lives and the movements of individuals. We need also to recognize that during HIV, just mentioning the travel bans, folks weren't able to all get across the border. So being in Canada, it wasn't until 2010 that the United States was giving the okay to freely allow for people living with HIV to get through. Now with COVID, folks are able to travel if they're an essential worker, and that update continues to come from the respective governments. But certainly the surveillance of our movements during HIV and during COVID is quite similar. Just the approach in the surveillance has shifted. So just being mindful of the use of our personal devices, of our media, or even of where we stay for extended periods that aren't our own postal codes. Just bear that in mind, that somewhere along the way, when we're celebrating the collection of data, that there's people in the background that are looking for ways to watch and connect your health to your location, and one person could impact an entire community just because they hung out for a minute.
Those are some powerful and incisive words, and I think that it helps to respond to even the earlier question, which is, are we all asking for the same thing when we're asking for race-based data? So what I'm hearing, and if I'm going to look for some clarifications, but first we're going to move through two more questions. That question kind of brings us forward in terms of when we talk about who goes missing, right, and what criminalization looks like. And surveillance was a key term here that came up, and a shift. And I just wanted to ask, Dane, when you talk about a shift, is it an intensification with surveillance, or is it a different kind of surveillance? So when you said it's shifted, what do you mean?
It's a gentle shift, if we will. So I'll take an app, for example. With some of the work happening in farming communities, migrant worker communities, there are apps available to connect workers to retail and social spaces. Well, it's COVID time right now, and those hubs and those spaces that workers may go to do their shopping or to socialize, whatnot. The other people on the other side of that app are sitting there waiting and ready to ask questions. Similarly to social apps, hookup apps, whatnot. If your phone has your location on, there's going to be opportunity for the watchers to watch your every movement. So promoting the use of an app and an app system. Those of us that love the Pokemon Go, better go sit down with that, because seriously, like, this is not the time to participate in those sort of group events where going for a walk could mean an $880 fine, especially for people that look like me, look like us. Like, this is not the time. So has it shifted? Yes, it
I'll rephrase that, because that's ethnic concentration question. I want to say thank you very much for that, Dane, and it takes us directly into our next question. And so, that question is, the discussion we're having today is to include a broader conceptualization of what is community. That is typically the case in moments like this. And so we're going to look at some of the invisibilized folks who are invisibilized by state politics, media, and obviously a need to have financial gain. And in this particular instance, I'm speaking about the very agricultural workers, migrant workers that you were just speaking of. So given that this population has been a mainstay of the Canadian economy for well over 4 decades, and if we include slavery, we've topped that. were agricultural workers included in the first pandemic, the HIV pandemic? When I say the first in the lived memory of most people. And do you see them being included in this pandemic in terms of the way we think about prevention and public health guidelines and the supports to be able to stay, out of the workspace when one believes themselves to be ill or is feeling ill? So can you talk about how migrant workers are going to experience and are experiencing COVID-19 compared to HIV?
Sure. So for migrant workers or for temporary workers, we're not speaking strictly of agricultural work. We need to remember too that the domestic programs, the caregiver schemes, that was happening also in the 60s, was primarily filled by people of color, Black people from Jamaica, to be specific. Eventually opened up to other communities and other people of color, but the employment and the work has been invisible and has been invisibilized, almost by design, because when we're thinking of, well, when we really think about the seasonal agricultural worker program in Canada, it started in 1966. Workers have been coming for well over 50 years, to the point where some communities are now employing second and third generations of families from abroad to work on the farms and in the communities. During the HIV period, were workers involved? Were workers being counted, being seen? In the caregiver program, probably more so, but generally speaking, no. Did they face similar outcomes? I can't speak to that. I honestly cannot speak to that. But during COVID, are we seeing some of the similarities that we can look back on from the HIV era? And the answer is yes. Workers are being invisibilized or kept in the background, but they will be amplified if they dare leave their space and go into retail areas where, for some areas, workers and people of color are not welcome. You're on mute.
Ruth, thank you, Dane. Can you also give us some reflections before we move on to Alex around what your thoughts are for temporary workers in Canada, and the way in which, for instance, in Ontario here, especially in your region, they may not be part of the COVID-19 response, and any reflections you have on those echoes to HIV as well?
So something that I think about when I think particularly about temporary workers, about seasonal workers, are that in the region where I am in particular, the concentration of agriculture is not the same as it is in some very close regions in proximity. So what I'm seeing is, obviously, we're a little bit away from, for example, Niagara, where of course there would be a real concentration of seasonal agricultural workers. Leamington, Chatham, where again there would be a significant concentration of workers. What I think about in terms of the response is that these are workers who are essentially a captive labor force. They're housed in dormitories where they cannot safely space from one another. Some of the images that have been brought forward by advocates and activists of pictures of how people are being housed in our shelter system and how people are being housed as seasonal agricultural workers look remarkably similar in terms of bedding on the ground, distance from one another, without necessarily physical barriers being placed between individuals. If an outbreak happens in a setting like that, of course, people are going to be incredibly susceptible to passing forward the infection. What are the barriers to accessing healthcare if you are a temporary worker? We know in the past that when people suffered injury and illness through these programs, they often received little to no treatment before they were shipped back to their home countries. Whereas they pay into all of the programs that fund our welfare state here in Canada. So they pay into our social welfare systems and our healthcare systems, but aren't able to access them. For those workers in Ontario, the one place where they may be able to access healthcare is a community health center. And we're not sure, and probably there's disproportionate mobile testing programs going on where people in some regions are getting tested and some are not. Something that happened with regards to isolation recently was in Haltom in Norfolk. The medical officer of health in that region saw fit to essentially give pass cards to the racialized temporary farm workers who were working in that region, basically something that said that they were clean because they had passed their isolation period, and therefore something they could show if they then ended up in contact with any kind of enforcement bylaw or policing. So a card that said that they were safe to pass, their passage card, which, not at all ironic when we think of the location where this is happening, Canada, where pass laws originated, where pass cards originated, and where not only Indigenous but also enslaved individuals probably would have had papers to ensure and assuage the state that no, they were actually given permission to go to the next work location by their owner to do work.
So I want to thank you for that history lesson, because I think for many people, the way in which history is told, or actually the way in which history is not told, is that the actual infrastructure of Canada as a colonial state and also as a constitutional democracy, it overlaps with the history of apartheid and the development of apartheid in Canada, being a world-renowned expert not only in developing apartheid systems, but also exporting them. And we can see that if we go back and look very simply and type in apartheid Canada, and we'll see that it was a South African regime of racial apartheid that came to Canada in search of better processes, received a wonderful tour, and took those back to South Africa and brought into place what we know Mandela, Winnie, and so many other South Africans had to fight against that system of apartheid for decades, losing many lives, being tortured and whatnot. And so that process is this process that still contains and restricts the lives of Indigenous people, but also Black people. That system of apartheid had two axes that it flowed on. It wasn't singular. And so for you to bring up the pass card, when I saw that in the CBC News, I was taken aback. I just physically moved back, and I thought, are our memories so short, right? I was just looking at an image of a pass card in the pass book when I was writing a paper that comes out in November, and to see it manifest in 2020, right there. And for Canadians to act like, oh, it's just a certificate. Like, what could be the problem with a certificate, right? And I'm like, I don't know. I think South Africa has a lot to say. I think Indigenous folks who have died to maintain their sovereignty, I think my ancestors, have a lot to say. And I think it's important that we have that history brought current. And for folks that are viewing, you'll be able to come to the site and go into resources, and we'll have some links there for you. So we'll be posting those over the next couple of days. So we'll be going back through the talks and pulling out key pieces of information so you can find it there available for you. And now, I'd like to move into the next question, and that question, and then I'm going to come back again to some of these pieces to tie it in, is why or why not, when we go to the next person, why or why not were people that were considered in the temporary work class not included, and why over such a long period of time have they still not been included in being recipients of benefits and adherence, the ability to have the security of those guidelines. So you talked about the barracks and the bunking, and many people don't fully understand that the housing conditions for migrant workers and temporary workers are not much different than we see in the US. So why, given so long a period they've been part of the economy, like we literally couldn't have grocery stores without those workers that are flush with produce, have there been nothing going on? And what do you think we need to think through in this moment in COVID for those of us that are not in the class of temporary workers, but have the ability to lean in on the system and demand that the system respond? And to the next discussant, please.
And would you like any of us to hop in on this one?
Let me jump Alex in here for a moment.
I think Dane or Ruth should go, actually. They have more expertise in this area.
Okay, right, go ahead.
Okay, then I guess it's me. So something that I think about when it comes to the conditions of temporary work in Canada is the fact that, much like enslavement, you have a captive labor force. Part of controlling people's labor is ensuring that they can't distance from their place of work. If someone's works in your household as a live-in caregiver, and their so-called private space is a bedroom that you've built for them in the basement, it's very easy to blur the line between work and personal time. Go down and just ask them for a little favor to do something after their work hours. It's very easy to continue to have that individual's work day stretch out beyond beyond rising hours, early into the morning and well into the night. It's very easy to exert both covert and overt influence on that person. We know that live-in caregivers, for example, are subject to violence, are subject to assaults, and are subject to coercion in their places of work. With the temporary farm workers, having those workers isolated on very large farms is not so different from plantations. Those workers do not have the means to get away from their place of work, to really strictly define their workday. And we know that they work under work lights very early in the morning and very late into the night to make sure that we get the produce that you mentioned, Lana. It blurs their workday. It allows for more extraction of labor from those individuals. It's not easy to get from those locations on your own independently to town to go shopping or to socialize or to find out about the location that you're in. So I think about housing and health and autonomy. Again, I look back and I see the connection between what's happening with these workers and their locations of work and locations of rest. And then I look at what we're doing right now under COVID for those who are underhoused and homeless. We haven't put everybody into hotels that are empty now. We haven't put them into university dorms that are empty now to ensure their health first and foremost and above all. We didn't take that as a first measure to prevent the spread. So immediately housing individuals to curb the spread of this pandemic.
And I wanted to pick up on that thread because when it comes to the viewing of like what countries had excellent responses, originally Singapore was one of those countries that was listed, and so during an virtual AI and COVID symposium, it was discussed around like what are these countries. So 4 countries were listed. Singapore was one of them, and this is in less than the first 60 days. And what came to pass, which was a question that I had at the time when I was listening, was Singapore is like a beautiful 21st century city in many aspects. It's actually the filming site for Westworld. And if you haven't watched Westworld, watch Westworld. And so when you look at that city, anybody who's aware of the intersections of life knows that that city runs because a lot of brown people, a lot of working class people are cleaning and polishing and shining, so that stays gleaming and pristine. And they're brought in by the busloads, crammed into vehicles to be deposited to make the infrastructure of that city work. And they were not included in their COVID pandemic response. And so now Singapore has a runaway train, not because of the workers, but because they didn't bother to make sure that the COVID guidelines and protections were available to everyone. And so now when we hear words like susceptibility for that population, it's being somehow cast as if there's something inherently pathological about their bodies, and it's because they're workers in these barracks. It's like, no, they weren't afforded the same public health controls that everyone else was. And so now, even some of the epi articles I've read and some of the popular articles I've read, the language around, and even here in Ontario and Canada, we have language like ethnic concentrations that fails to do a kind of critical work and supports a particular kind of stigmatization. And so we have a question here, and I'm going to take that before I jump over to you, Dane. It says here, Caribbean governments are saying that migrant workers are being given the best health and safety. This nuance and information is not being told to us in the region, and hearing this is great. So this is perfect for you, Dane, because I want you to tell us, because you're going out east, you're going Durham region into Eastern Ontario. So can you kind of respond to what's being said versus what it looks like for boots on the ground, as the saying goes?
Okay, so for Jamaica, and I don't have the info handy to reference at the moment, but please do look it up. When COVID hit, and when workers were arriving to work on the farms, Jamaican government essentially said, we'll take care of things, and Canada will take care of things, but if you're exposed to and diagnosed with COVID, that's Canada's problem, not Jamaica's. So the question on this side becomes, well, what are we doing? What are we doing in that case, in that event that outbreaks do happen? Because we are seeing and reading about what's happening in Hodman and Chatham and in other regions where there's breakouts or outbreaks happening of COVID. Are we to say then that at the end of the season, the workers aren't going to be able to go back home? Because if that's the case, then for the politicos listening right now, then we need to strongly take a look at what the interim federal health program looks like, and take a look at what we mean, what we really mean when we're talking about temporary work, permanent temporary work, because still workers aren't able to, seasonal agricultural workers particularly, do not have a stream to seek residency, to seek permanent residency in Canada. Actually, they got to sit out for a year in the program in order to begin the settlement process in Canada. But now with COVID, and then also going back with HIV, if there's a new diagnosis and it happens on Canadian ground, what are we doing and what are we going to do to make sure that workers are able to be cared for here for when it comes time for them to want to go back home? What are we doing with regards to the census data that tends to be timed around periods in which workers are at peak working conditions? So again, like how are migrant workers being counted? Well, if status isn't available for permanent residency, they're not. So interim federal health and other interim measures. Let's not forget also that we have international students who are also at risk for COVID, for other infectious diseases, other reportable communicable diseases that may be impacted in their settlement or repatriation. We need to just recognize that when we're looking up this information, when we're asking for data, and when we're asking about how we're going to use the data, we really need to think about how it's going to be used to strengthen the current interim systems that are provided, because there is no reason why workers, particularly seasonal workers, should have to risk making money and being barred from going home. It's not right.
Okay, so there's a lot of pieces that were in there, and so I just wanted to kind of take apart a couple of them and then move us into the next question, which we've already crossed into. And so in this kind of recap, I want to touch back on risk. So we talked about risk of what might happen if, while being here in conditions that are not consistent with the same guidelines that Canadians with citizenship or permanent residency have. So they don't have control over the size of their living quarters. They don't have the ability to self-select if they believe that they're at a risk of exposure to sleep elsewhere or to self-isolate. You described very accurately and very vividly, Ruth, that it's not unlike historic and present plantation setups where you're working under lights into the morning and way into the night. And so these are not the best conditions. And so these are conditions that actually press people up against the likelihood of being both exposed to COVID and having to hopefully survive it. And then there was this link that was made to, well, okay, if you survive and you maintain your health, is it fair that you are moved and retained in a way that could either keep you from your family or push you back in a kind of, if you get ill? It sounds like from other experiences that were being described that when workers became injured or ill, that often they were just dumped back in their country. They were not given the opportunity to take advantage of the services that they paid into, in terms of having paid into the worker programs that we have here that allow you to get WSIB or rehabilitation. And so now I wanted to kind of cross that over to when you talked about being able to get off the site, whether you work in a domestic home, you're providing care for children, elderly, and you're a live-in worker, or whether you're on another temporary work site, a factory or an agricultural site. There's this piece around surveillance, because Dane, you spoke earlier to the fact that if your cell phone is on and your locator is on, understand that what they're doing, when the mayor says, we've got your cell phone data, it means that you're a little, as you said, as the Pokemon goes. And if you're discerned to be a risky population because they're creating a high site of risk where you live 24 hours a day, that your simple presence in a location could be seen as need for patrol, arrest, or identifying other people as being at risk and then putting them under additional surveillance for doing nothing more than going to the grocery or trying to get something, because the very nature of your work and how it's constructed by others creates conditions that then you get labeled with, that can make you available to surveillance. So this question says, what is reminiscent in the narrative of surveillance in the HIV pandemic that you're seeing reproduced here in the COVID pandemic? And I'm thinking here of the way in which police became very involved in the early HIV movement and was trying to find out where different, quote, populations may be hooking up or meeting each other. And now that COVID is present, simply talking to your BFF can now implicate you in a potentially public health concerning event. So if we can have Alex weigh in on that one, what echoes are you seeing in terms of the surveillance narrative and connecting it to what Dane said around surveillance?
Sure. Thank you, Lana, and thanks, Dane and Ruth. When I think of what's happening now and also appeals to public health and kind of the rise of public health authoritarianism and surveillance, I always think of what Gary Kinsman, one of the founding members of AIDS Action Now, says. When we talk about public health, we have to talk about who is the public in public health and whose health are we talking about? So when, Lana, when you were mentioning Singapore, migrant workers were not the public in public health. And here is the same thing. And people who live with communicable diseases like HIV, we are not the public in public health. We are the public. We are the people from which the public is to be protected from. And so that means we face heightened forms of surveillance, heightened forms of control, heightened forms of policing. And I think one of the things that has happened under COVID is that police have been positioned as a central responder and a central actor in responding to the pandemic, as a legitimate responder. And also the other thing that's been legitimized and reinforced, which has kind of moved forward from the HIV pandemic, but it's really been more entrenched, is that partnerships between public health and police have been really cemented really strongly in relation to COVID. And so we're seeing that in Ontario, for example, with the sharing of healthcare data, COVID positive data with police under the Emergency Management and Civil Protection Act. So anyone who tests positive for COVID, their data is being shared. And in Ruth's jurisdiction in Waterloo, the Waterloo Regional Police Services were one of the first police forces to come out saying that they were actively going to be using this list of people who tested COVID positive. They're also one of the police forces who were caught in the AI, Clearview AI scandal using facial recognition software, which is highlighted as a massive violation of privacy rights, and they had to stop using it. So this use of technology, I think one of the things that's reminiscent of HIV but different, we're in a different context, although HIV is ongoing, is the technological solutionism that we can use technologies to address the pandemic. And I think we're also in an unprecedented space where the sharing of data is much more streamlined and possible. So we can see the sharing of COVID positive data with various jurisdictions and police. So in Toronto, for example, on the Toronto Transit Commission, there was this thing that happened in early April where there was data shared with bus drivers all across the system that said, Black woman, COVID positive. Apparently there was a picture of her with a description. She was in the Jane and Finch area, and it said to not pick her up. She was homeless, do not pick her up. So we saw this unprecedented sharing of COVID positive data with public service workers to deny someone access to a public service, highlighting their race and that they were homeless, which is extremely troubling, which is something that's possible now in the current context, which wasn't necessarily possible in the early days of AIDS. It is possible today.
And I think that's a stunning example of like what's underneath the call for race-based data, right? That when we contextualize something in the current moment, something that was benign and less dangerous, it never was no risk, but it was less dangerous to ask in the 90s, even maybe before 2003. But with the advent of the internet at high speed and now moving into quantum computing, the game has changed, right? Technologically in 2006, 2007, and it's quite interesting that this discussion of race-based data hasn't been located squarely within the reality of the technological police state that Canada has evolved to be, like so many other countries in the world, especially as these countries shift further and further to the political right, where there is a law and order agenda. And that agenda is not just political, but it means that they're literally taking money from education and health and funneling it into police departments and state police departments like OPP, and that they're ratcheting up. We can look at the Toronto Police Services budget over the last decade, and we can see an increase in purchase of paramilitary equipment, right? And technological paramilitary equipment, like we've seen used in Latin America against citizens to put down their commitment and uprising to maintain constitutional democracies, which is what we have right now that we're grappling with in Canada to evolve past, right? That. And so when you hear you highlighting that in the first iteration in the HIV pandemic, our records were more paper-based, right? But now that we've had COVID and it's been described in the American media as a live experiment, the techno-determinism is very clear. So the answer to very much of the pandemic is technology, 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 as if technology isn't coming into play by very human, very specific requests, by very specific political orientations around very specific programs about policing and public health, as you said, the relationship becoming cemented. And that this is something that came up at a meeting that I was at, and I'm just going to take a segue before I pull you in, Dane. And that is, there was a talk at a roundtable, and there was a discussion, and there was some, I was listening, and I became very kind of disconcerted because there was this discussion as if the use of machine learning and AI was just benign. Like it had no potential negative implications. And I thought, we're in a province where the police and public health have a very intimate relationship, one that would make many Canadians uncomfortable if they actually, pulled back the cover and looked at what those articles entitles them to, supposedly, right? And so when we talk about data moving, we have to understand that data is just data. We might put health in front of it, we might put policing in front of it, but that's meant to be a unit that just moves freely because of interoperability in terms of platforms. And so this is why it could so easily show up in a police car dashboard, your COVID-19, and what happens, what else gets in there? Does your appointment with your clinician to address another personal, like what is the limitation of that? Because there's been no public hearing, there's been no public decision about whether, as Canadians, that's an appropriate use of technology. It's been a unilateral one, coded in the language of emergency. And so I think it's very, it's very timely that you should point out that we've seen this before, that we have examples of where it is misused. Because when a public service denies somebody, and we don't know, for instance, that woman could have needed to get to help. I mean, right? And the question is, how did that information get there, right? How, and is this what happens when you put transit police? Do they then become the bridge because they're another part of the police services? So now, bus, subway like these people all become exposed to the security system, to the surveillance system that's being used. And so does that now mean that we are experiencing very much what we see in other jurisdictions? And that came up yesterday in that conversation about looking not just provincially, but where are these concerns shared? And we see that in China, this is the kind of surveillance that is present. And when we looked at those examples to the east, there was a very good discussion by a CBC epidemiologist that talked about there's a different culture that's tied to different political systems and different ways of implementing public health. And so the certain kinds of incursions into constitutional rights, such as privacy, are different in different parts of the world. So you can't just take technological solutions and arbitrarily put them in constitutional democracies and say, oh, well, it's a state of emergency, because that's not how a constitutional democracy works. And I think there's some political, like how our civic system works. And so I thank you very much, Alex, for kind of bringing that down to the bare bones of like, what does that mean and me walking around? So regardless of whether you're Black, but we know that if you're Black, you're more likely to be carded. So you're more likely to be asked for your pass card, right? So how long before that pass card migrates from a sort of optional tool being used to temporary workers to those of us who are on this call and to those of us who are listening? And who's more likely to be asked for that pass card if it was done to the whole population? Alex, would you perhaps be someone that would be asked for your pass card as much as, say, Dane or Ruth or I?
No. Yeah. And carding now is legalized under the Emergency Management and Civil Protection Act, so that enforcement officers, bylaw officers, and police can stop anyone at any time and ask them for ID. And we've seen that happen in Ottawa a number of times where I live. Syrian migrants have been asked for ID in parks just because they were alleged to not social distancing. A Black man was with his daughter. He was asked for ID from police. He denied it because he didn't believe it was his legal right to have to show ID, but it is now. And so the bylaw officer punched him in the face when he was with his daughter because he didn't show ID in public to this bylaw officer, who's essentially a deputized parking attendant who now can enforce public health rules and demand people to show them their ID. So we have legalized carding now, once again, because of COVID.
And I think
humanitarian.
that's something that, you know, we have to ask ourselves a question: why aren't people pushing back? Because we know that during crises like this, and for those of you that have already signed on, the part 2 registration is open now, and so the first talk of that is myself and Naomi Klein in conversation about how surveillance and different systems are working together through tech and privatization to kind of help us think through, like, what does the pandemic look like when we think about where technology is present. We've seen this before, right? We've seen it many times where a crisis either happens naturally or is pushed into being because of particular kinds of conditions, and then governments or other actors take advantage of those and try to override the constitutional democratic system that's in place by eroding it, by undercutting it consistently, and bringing systems to the fore that we hope in our lifetime would be shedding, but actually they're pushing us back, because to think that these instruments are equal, we've already seen, as each of you have described in different examples over history, that these systems are not equal. In South Africa, whites were rarely ever asked for any kind of identification. It was assumed that they were allowed to walk, just like it was and is for white-skinned Canadians, right? They don't have that kind of ask happening. You know, I have friends who are just, it's mind-boggling when they see it happen. They're like, that really happens? And we're like, yes, all the time, right? And so to think about how the pandemic is being used as an active instrument to bring back processes that were deeply criticized, that the actual COVID statement from the United Nations that was drafted and distributed, and recognize that there's a statement from the United Nations around people of African descent and COVID that states that human rights, civil rights, should not be rolled back in the interest of forwarding what gets conjured during a pandemic, because we know that when you bring something in a crisis, it doesn't go away, it deepens. And so we've had a number of experts and pundits talking about whenever you bring in something during a crisis, it not only stays, it doesn't take on its quote temporary tone, it actually deepens. And we've seen that because many of the ways in which surveillance has amped up is because of what happened in 9/11, right? And so all of these new institutions and rights to access data became normalized, and now it's let another layer of privacy and constitutionality being pushed back. And so I'd like to ask Dane, when you think about these surveillance narratives, like, you know, you really brought them up early in the conversation, because you said, if you think that where you move is private, as long as your phone locator is on, you are in the arena being viewed on the board of pandemic, potentially response units, however they may conjure themselves. Can you talk a little bit about that? And you also talked, when you opened up, and you spoke to the folks inside, and so can you speak to them about this as well, for those that will be coming out to the outside and thinking about what they can do for themselves as they move back into the community, and what their families and friends can do to keep everybody's health well, since so often on the inside, they're denied the ability to maintain the very same protections that the rest of us are afforded, and that the Constitution protects.
Sure. So with regard to early release programs and the release of low risk incarcerated peoples, where are they going to go? Where are people going to go? Because if there isn't a social setting or a family or familial connect available for the individuals being released from the prison complex, where are folks going to go? They'll be in the communities. They'll be dropped into the communities, and probably be dropped in good health. But if there's not shelter available, if there's not opportunity to find space to distance, the whole shelter in place for somebody who's left a situation where confinement was just part of the daily routine, we've just put them at an increased risk of exposure. And if we're gonna look at this as early release is good, but then keep taking notes on their every move when it comes time to return, or if there's a reoffense and folks need to be placed back inside. What if they've been exposed? We've read about and heard what's been happening in various prisons around Canada. Quebec has an outbreak happening right now. We need to recognize that when we talk about shelter and sheltering and how we survey people who are less at risk being away, and now putting them in a position where they are now vulnerable, we're gonna start seeing a compounding of oppressive practice to folks who really just want to mind their business. When we're talking about surveillance and high tech options, let's remember the low tech as well. The neighbor that's sitting on the stoop just minding their business, but taking tallies of Black people and people of color just taking their kids out for a walk, going walking across the park. I'm just looking outside right now, and I'm seeing people walking. People that don't look like me, they're not going to get called, but pretty certain if it was a family that did look like me, there'd be 2-3 cruisers that roll by, because we see it every day. And for folks that want to look the other way or think otherwise, like, take a closer look at who the eyes are in your neighborhood, because that person sitting on the balcony minding their business is probably sitting there using the high tech to send a note to police services, to security, to bylaw, to say that, oh, this person is disobeying shelter in place policy, or they're going with a group more than 5, when in fact it might be a family of 8 that just needed to get out of the house and are walking together just to get some fresh air. We need to recognize that we all have a role, and we all play a role in how we watch each other. We can either do it in a good way, or try to do it in a good way to make sure that you can walk safely, or we can all look out for ourselves and snitch on each other
and deputize ourselves to police other people.
Black people, please don't snitch. Don't snitch on each other. We were seeing this in HIV. Mm-hmm. We continue to see this in HIV. Mm-hmm. Don't go posting and blasting about any parties or any circuits happening. Just leave people alone. Leave it alone there. Leave it alone now.
I want to thank you for that note, Dane. I think it's always important to remember that public health and who's in that public health, as Alex was saying. And when Ruth, you were describing early and giving your answers, it's very clear who's not part of public health. And that seems to be always whatever does not fit a particular idea that fit Canada's historical whites-only immigration policy. It always seems to go back to that register. To fall in line with that policy, and to almost go back to this nostalgic place where that policy reigned and defined who was the public. And so we see the remnants, we see the residue of that kind of stuck to everything. And then who's looking at who. And so I want to bring you in, Ruth, and I want to talk about this phenomenon of, which is going to come up in part 2 in Surveilling the Surveilled on 2 o'clock next Friday. And we'll be having folks that are going to talk about the surveilling the surveilled. And so, Ruth, I want you to come in on this question that Dane just finished up on, and also kind of giving a little bit of a commentary that the Amy, who was caught red-handed, flat out lying about being attacked by a Black man in the United States in Central Park, also happened when her details got shared to have lived and gone to school in Waterloo, right?
Yes.
So we have a Canuck,
Mhm.
who's someone who spent a lot of time in what was described yesterday as Canada's claimed innocence, as if there is no racism here, there is no anti-indigeneity here, there is no, as if, but we know differently. And it was quite interesting to see that pop up. So if you can talk about a little bit, giving us a little insight into how that surveillance is uneven, especially given your roles on the harm reduction committee and your roles in trying to create continuity of care, and how people get pushed out of accessing even any opportunities for HIV, much less COVID, because of them being surveilled.
Okay, so I guess what I think about when I see that interaction and other kind of small constellations of disparity is a few different things. So yes, we did see this situation where someone was in a very direct, overt way, weaponizing racism to cause harm. What I think about when I see that, and then I think back to our larger questions about HIV, about COVID, and about data, is when we get information, whether we choose to overlook it or and how we choose to act on it. So in this particular situation, people have spoken about the fact that this individual is Canadian. People have spoken about the fact that she is a graduate of the University of Waterloo from their actuarial program, and had a very prominent position in an investment firm in the United States. And perhaps part of her rage reaction and desire to control this man was, one, there was a Black man who was saying that she had to follow rules in public space to maintain safety. And her ire probably had to do with the fact that not only a Black man was telling her that, but a Black man who obviously had had access to education and was using civility to her, which is something that she probably thought only she should be able to use and weaponize. When I think about that, I think about the data that we choose to ignore and the data that we choose to take in. So, there hasn't been any call out, if I can get colloquial, about, like, Canada, come gather your people, Becky's, Amy's, come gather your people, any of that. So looking at it as an individual phenomenon rather than an instance of a structural issue, right? Anti-Black racism. If I skip across from there to some of the little bits of interactions we're hearing about here in Canada that are also data, but not large pockets of data. Something I spoke about before it was recorded in newspapers in regards to health systems was the fact that likely Black people showing up, requesting care, saying that they think that they have COVID, would get turned away in emergency rooms, and their claims that they themselves were advocating on behalf of themselves, saying they needed screening and they needed care, would be dismissed. We have found in the case of one of the 6 PSWs who have died in Ontario that yes, a Black man did have his claims that he needed care dismissed. He was discharged or dismissed without being admitted to hospital and died at home. Is that data is going to be used as a case study and a lesson learned to enforce systemic change? Likely not. We have a case in Ontario where all of the PSWs who have died are racialized and 4 of them are Black. That data has not been taken up in media, in discussion of the exposure of essential workers, and that those workers are at the intersection of a particular intersection of race and class. Right? That data has not been brought together to say that then we must be focusing our public health responses in a way that equitably puts more resources in the hands of these people who have been made vulnerable in these systems, and therefore ensure that they get appropriate levels of care.
So I wanted to kind of come back to something you said, Ruth. When you talked about that white paper, the system's failure, and the system being the state system, supposedly public health is supposed to work for everybody. We have a universal healthcare system that Canada is known and loved for the world over. But little discussed is the way in which Black people because of Canada's benefit of slavery and its own institutions, continues to carry that over to all Black people, whether they're coming now or whether they've been here for multiple generations. And so there's this way that Black folks always go missing or get pushed out of the picture. And so we hear this call for race-based data, and I'm taking it back to the original conversation, because part of the reason this event happened is because so many in the Black community that were not of a particular, ilk, who live at the level of constant surveillance know very well that the police are very much on their race and spend a lot of time focused on their race. And they don't need race-based data. They need action to push back what race-based data has already generated. And so I think this is where the tensions of class, come to play. I think attachments to institutionality. I work in a particular profession. I work in a particular proximity to the academic industrial complex. So there's a lot of believing in structures that history and a lot of literature tell us are not responsive to the project of ensuring that even though Black folks have been emancipated, for those of us from diaspora, that we still live in this different class of human and this different class of citizen. And so can you talk a little bit more about the piece around who gets included? Because you were describing it in a different way this time. So I want you to just kind of recap what you just said.
So I think about what I just said around hypervisibility and invisibility. So Dane spoke so much to hypervisibility, and Alex as well, in terms of how data ends up getting aggregated, turns those who are most marginalized into problems, right? So become hypervisibilized as problems, yet invisible when individuals self-advocate because they are seen as subhuman, as unreliable narrators. I am saying I need an intervention right now, and that cannot be heard and cannot be taken in a system, right? Whereas all of the data that the system chooses to collect defines those individuals as problems, as diseased, or as deficient. So what I think of when it comes to these particular instances is how to harken back to what was said yesterday, that data in and of itself doesn't fix anything. But even more so how data is taken in. And so this is where, of course, we have to have a critical race analysis, we have to have anti-oppressive practices, and we have to have individuals who actually have the expertise to ensure organizational development and organizational change, or ensure that those who are doing the work, the grassroots organizing on the ground, and the mutual aid projects are seen as experts and reliable narrators as to what is needed to foment an effective response that doesn't push people out or leave them behind or pretend that they were never there in the first place.
Okay, and so I'm just seeing from a listener or someone who's watching a question, and I just wanted to offer the clarification that so you're saying that the data we need to be looking at is not the collection of race-based data, but the responding to the reliable narrator as the person experiencing it, and moving from that way forward around what data is gathered in. Okay, we're trying this response that is critical and looks at the intersections of race and income, but we're not collecting data for the sake of data about the individual. It's about the response that is actually doing something.
Yes. Can I give you another example that might be better? Mm-hmm. At the ASO that I work at, some of the data that we had said that the HIV clinic that our clients were going to had a 25 to 40% cancellation rate over 5 years. Other data that we had said that whenever we tried to intervene on the behalf of our clients with regards to primary care settings or urgent care settings, people were having absolutely atrocious experiences. So given the evidence of that data that showed systems failures, we created our own system. We decided not to play in those playgrounds anymore. We brought healthcare in. Healthcare that was delivered for the most part by nurse practitioners and nurses, as well as HIV care that was under the auspices of another HIV/AIDS organization. that changed things drastically in terms of people's interactions with healthcare. They are now forming relationships with those healthcare providers physically located within the organization that they feel is safe, rather than trying to prove that they are reliable narrators in outside systems.
Okay.
Rather than focus data on aggregating data that talks about how individuals fail to show up for appointments and how individuals fail to do what we tell them to when it comes to health teaching, we chose to collect data that showed how the system wasn't doing what it is mandated to do for the people that we serve. And we found other vendors who are willing to do it and brought them in-house.
Okay.
So we collected data on the failures and points of intersectional recognition where people were not being seen and erased or pushed out of other systems.
And I think some of those points are really well taken. Alex, can I jump to you? And then I'm going to pull us into the next question because we've already gone there. And the next question I'm going to set up just before we go to Alex is around government and community responses. Alex, can you maybe add a little bit more thinking about the criminalization aspect?
Sure. Thanks for that, Lana. I think just jumping off quickly also of what Dane was saying earlier about snitching, I think one of the, in terms of work I've been doing with my colleague Alex Lubstone on policingthepandemic.ca, we've been tracking the enforcement of COVID across Canada. And one of the things we started to realize was that snitch lines were really a big factor in terms of enforcement. So we started tracking snitch lines as well. And we found that there's about a little over 30 COVID-specific snitch lines or information lines or lines that people have been advertised for people to report non-compliance to. The highest concentration of them is in Ontario. So Ontario is a province of snitches, which I think communities that have been made to be marginalized and oppressed will already know. But I think that was just an important factor in terms of that. So I think really highlighting that snitch culture is one of the kind of main drivers or one of the main components or one of the leading components in relation to enforcing pandemics and communicable diseases is important. And I think we know that with HIV as well. I think in terms of, Lana, I actually don't remember what the rest of your question was.
That's okay. I'm going to take us back into it.
Okay, cool.
I was just trying to knit it together because I wanted to also just take up something you said around snitch lines and there being 30. One of the things that's also came up that, brought this particular composition of the symposium together was that workers were in spaces where their employers were making it impossible in Ontario during this lockdown to actually live the guidelines that would decrease transmission. And so the use of stitch lines for labor sites, the use of enforcement officers for random audits and checks, which we know actually works because that has worked for cholera, typhoid, to make sure we have public health inspectors to prevent transmission of things. So instead of invigorating those systems that are employing masses of people, typically 25, 50, 100 or more, to go around and be doing site audits and doing demonstrations and bringing in managers and owners and saying, you need to move this apart. We're going to be back at a random time and date just to make sure that the system doesn't weaken. Resources aren't being put to that. We don't have snitch lines going into specific workplace sites to act as a deterrent to employers and those who make profits to make sure that they don't weaken the public health response. Instead, that energy and that money is being invested and downloaded to individuals who are being subjected rather than being able to decide to maintain their decision to be safe. And we've seen that reported in the news, not just here in Canada, again, looking up in the US, across the world, we've seen that the hotspots aren't actually generated by, quote, ethnic concentrations or close living quarters. They're generated by the labor practices and laws that allow those sites to maintain unsafe conditions that pay low wages and have racialized hiring practices. And so I wanted to take this now to the next question, and I'm just going to go to Ruth or Dane, whomever wants to go first. Even though the pandemics, again, are different, what lessons from the way the government responded versus how the community responded to the HIV pandemic can help us think through our response to COVID? And so if we can start from the beginning. Like, for instance, why is there no safer sex message around COVID when we know that regardless of what flu you have, whether it's COVID-19 or the seasonal flu, that it's transmitted in seminal and vaginal fluids, and that anybody who's already living with an autoimmune disease or autoimmune suppression, whether it's HIV or otherwise, should think about what their choices are to decrease, their health. And so I want to start there. Like, where's the basic messaging that public health is supposed to be doing? And then if you can go outwards to how research gets into this mix in a way that may or may not be helpful.
Okay. Are you cool with me going first, Dane?
Sure.
Okay. So some things that I'm thinking about here from both the community as well as from government are a few different things. So I think about what resources there are given and where the resources have been given, at the various state levels. There has been a lot of asking by the general public as well as by institutions that are trying to mount a really robust public health response for resources. And the ask and the give are not the same. And that's something that I want to be honest about. I work very closely with people in my local Department of Public Health, and they are working incredibly hard and they are under-resourced. Our departments of public health are supposed to be able to maintain all of their regular public health activities, which keep population health, to keep the majority of people well, while also dealing with a pandemic. Our local departments are not able to keep up all of their other activities, whether it's vaccinations, the clinics that they run for the public, and other monitoring things they do to ensure that we stay relatively healthy at the same time as mounting the COVID response. They have asked for very specific types of resources, including resources for the homeless population, and they've been given some resources, but not the amount they have asked for in terms of serving the needs and housing the homeless. I want to make that clear. I think that at the same time, our focus on trying to bring in surveillance and policing to mount a public health response, we cannot police our way to health and well-being. Think about other public health responses. The Well Baby package that is given in Scandinavian countries to new parents. When people are dealing with someone and screening them for COVID, and that individual is homeless, and we know that they can't safely distance from others, and they may be asymptomatic, the person who is dealing with that individual can't do social prescribing, even though they want to. They can't say, here you go, here's a safe place for you to stay away from other people so that, you can't transmit to everyone else and you can stay well so that I don't have to circle back to you while I continue to mount this public health response. Okay, at the community level, and I'll say this and then I'll let someone else speak. What is happening right now, and I'm saying this because I want you to talk about policing the pandemic more, Alex, is that there's many different types of mutual aid happening. And mutual aid is a beautiful thing. It's a political thing. It's organizing for the revolution to take place. It's also something that happens when systems do not take those that are most marginalized into account, and people know that we got, and they have to organize with each other to ensure the communities that they're a part of stay safe. So mutual aid is happening at my organization because I said we are going immediately back to 1995 mode, and our staff know what that means, and we set up phone trees and we do check-ins on everyone that we engage with on a weekly basis to make sure that people are getting what they need to stay safe and healthy during this time in terms of their material needs as well as their mental health. So mutual aid, yes, it is very nice and beautiful and warm and fuzzy. And it also is what happens when you know that there is not going to be a full-scale response mounted to make sure that you're okay. And I see policing the pandemic as another form of mutual aid and organizing under surveillance to make sure that many marginalized communities are okay.
Okay, and so I want to jump over to Dane, but just as we do that, Ruth, you talked about it, and also it came up in prior. The cuts to public health that were done under the current government were quite substantial. They wiped out complete programs. Not only did it produce unemployment, but there were complete chains of access that were diminished. And they were advised not to do it because it exists for a reason, even though it doesn't look like an apparent reason. And, not several months later, we end up with the global pandemic that we knew was coming all along, because if you study epidemiology, as some of us do, you know that these things move in cycles, especially when we do particular kinds of activities on the planet. And so public health was cut, and that gets taken out. There's a reason our frontline workers are the people who work at grocery stores at the lowest income wage. There's a reason that your quote essential workers are not government employees who are trained and have the best working conditions in order to, lead by example in their communities, but they're in the lowest protected worker class in the province. And we have to ask ourselves, how did the essential workers stop being the workers paid for by people's tax dollars to ensure a good level of public health service and working conditions? How did that become who are now being relied on as essential workers without good essential care, right, from the state system? So there were public cuts that made what we're seeing directly tied to the deaths and the health incursions to some communities more than others. And so Dane, I wanted to ask you, in terms of those community responses, you've been really great about kind of pointing out the boots on the ground. So I'm going to use you to segue into the last question. And that question has to do with the piece around what kinds of refusals might we have to make given the presence of artificial intelligence, clear face recognition. I mean, it's not a coincidence, is it, that the police services had the data in Waterloo, the headquarters of, Google? Like, these are cities that are vying for smart packages, and we saw them pull out of the front, sidewalk labs, pull out of front, the waterfront struggle. And I got these emails, oh, you must be so pleased. I'm like, no, they're just at the pandemic threat response. They just went down the street. I mean, they've abandoned this project because it's a political mess, but more importantly, because all of the pandemic is being looked at as an opportunity for technological solutions that the public clearly mounted a response to and had rejected. And again, for folks that want to get more into this conversation, Naomi Klein and I will be talking more specifically about this. But to you, Dane, can you please kind of weave in what are some of the practical tips that you would offer people about their movement, about their location, about the kind of data? Because this conversation is, does race-based data mean the same to everybody? What would you tell them as we go around on this outtake, this last question? How do we keep ourselves safe? Because it's being handed to us that either you give up all of your privacy and constitutional rights in the name of ending the pandemic, or you perish. And, most people can understand that there's and. You can retain your constitutional rights and right to privacy and end the pandemic and be healthy. So how do we do those two things at the same time? What are your thoughts?
So understanding the greater and meaningful involvement and engagement, bring it back to the community and to the ground. Any federal, provincial, or municipal money coming to this response, put it on the ground. Don't put it in the ivory towers. Don't give priority to aspects that aren't doing applied work. Like we're in a time right now where we're talking about COVID. In HIV time, we were talking about how are people going to eat? How are people going to be able to get some of the basic essentials that they need just to get to the next day? We've had to expand our limits or our reach, if you will, and forcefully partner with other organizations just to make sure that everybody, particularly everybody that we work with, are provided with some equitable treatment, some equitable care, health care, nourishment, nutrition, even doing some things that by the book may break a rule, but it means that we're preventing an outbreak from happening. We're preventing an exposure from happening. To what Ruth was saying about 95 mode, phone trees are what's happening. Phone trees are what really bring home the value of the work, really amplify what the work of an essential worker provides to communities. And also using things such as Post-it notes and just notepads to communicate to people passing by storefronts, letting them know that, hey, we may not be physically here during posted hours, but here's some information that you need to know, and providing them with information and direction to whether it be health and hygiene hubs. Just understanding that, options are there. They don't always have to be high tech. Using the lower tech options to just get people what they need is working and is working in some areas. Now, with regards to use of tech for surveillance purposes, well, on the other side, for folks that want to go and see what's going on, so talking to your police, if you're going to take a look at a Post-it note to see that, if you go to this location, you'll be able to get some food and get checked and tested for any medical concerns. When you get here, just understand that we also have distancing protocols in place, and you're not going to be able to police your way into impacting the safety and security and confidentiality of those who really need the community's assistance. So, just continue to take time and back off and let the communities take care of our neighbors. Over to you, Alex.
Yes, so jump right in.
Okay, cool.
Ruth,
totally agree with everything that already was said, and I think as someone who has a reportable communicable disease and has been treated my entire life as though I'm a threat to the Canadian public, I would say that we have to understand that public health, as Ruth really eloquently outlined, does not have our interests at heart. It's not an institution that is benevolent towards people who are not the public. And so I think what that means is we have to consider how we engage with that institution in a way that we can protect our own communities and each other. And so I think, as I've spent many years kind of working to ensure that people living with HIV can keep themselves off of the state record of public health so that we can protect each other and keep ourselves out of harm's way. And part of that does involve breaking rules. I think in the harm reduction movement, people say the statement that breaking rules is our path to survival, and following state structures of violence. The rules of state structures of violence are not going to lead to our own survival and community safety. I think that undoing the paternalizing logic that we are a problem to be solved, or that people with communicable diseases or that Black people are a problem to be solved, I think is the thing that needs to be done. And so I think Ruth really eloquently outlined how communities need to own responses collectively, and undoing a top-down structure of a mommy and daddy knows best paternalizing logic of public health is one of the ways to do that. Really quickly also, Lana, you mentioned that why isn't there safer COVID safer sex messaging out there? And Toronto Public Health actually just did launch a safer safer sex messaging. I don't even know how to say it. A document which said primarily that you shouldn't have sex with people that you live with. And one of the things that that was really underlined for me in that, and I can share the link with you if you're interested, is that they're kind of signaling, oh, that we're going to actually start enforcing this as an issue. So while it's cloaked in this idea of information for people, I think what it highlighted to me when you look at public health more critically is they're saying they're going to start looking out for people who are having sex with people they don't live with, and they're going to start enforcing this because people with COVID are not the public that public health is interested in protecting. So I think we always need to look at this stuff very critically, and it actually made me quite concerned. But those are some of my thoughts.
I think that's when we think about surveillance, we don't think about how deep it goes. And so I think it's always important, as it was brought up on the panel the other day, to not always just look inwards, but look outwards. And so there's this narrative that we have a constitutional democracy. I brought it up, that it's Canada, that there's this idea that somehow we still have our rights. But we can see that even though the UN issued a statement to remind nation states like Canada, like the US, France, and the UK and the EU, don't tamper with your rights framework, because that actually makes pandemics worse. We're seeing it happen, right? Where people are being policed right into their bedroom. And there's no evidence, actually. What's interesting about this, when you look in the actual literature, the research literature, which is what science is supposed to do, you don't find evidence that supports these kinds of policing interventions. In fact, it's actually the opposite. What's effective is the opposite of what we're seeing. And so I think it's really important that when we talk about this original ask, which is, part of why this symposium exists, because different people within Canada, within Black Canada, are having very different experiences of hearing the question and the demand around race-based data. Yes, on the one hand, we understand we don't want our deaths to be obscured, denied, as they already have been. But we also know that by having the data about that, it just becomes, oh, look, you have the numbers now, okay, go away. So we've seen that in America, where there's a plethora of data and there's still an ask for more, and they have a different structure and a system, so we'll leave that there. Whereas we in Canada have not taken up a refurbishing of our apartheid system through adding racial markers that migrate. Because this question in closing was about surveillance, right? That if you put a racial marker in COVID data and it's tied to your health card, it's the toggle, like it's literally a programmer hitting some code, and now your health card, and there have been long calls to have health cards racialized, but luckily, numerous voices have weighed in and that's held off. But this policing can go right into your bedroom. And when you attach your race to that, like, could you imagine, like, we already have the pass card, apartheid. Like, we have all of these artifacts populating the landscape, seemingly disparate, seemingly not related. But we've seen this before. We have it in Canada, right? And we know it because it still lives in South Africa, despite their entry into a constitutional democracy that's not simply racial apartheid only, but and so as we come to the closing, I want to say thank you to each one of you. I also want to say the word vulnerability, susceptibility, these words were used here, but as you can see, each of these speakers is using it from a critical perspective. And so there's a paper that was published in 2019 that takes up that word in the similar way that it was used here, and it's called Vagueness, Power, and Public Health: Use of Vulnerable in Public Health Literature. And several folks that I also know very well wrote this paper, and it breaks down how vulnerable can be used to mask some things. But as Ruth said, it's actually vulnerable eyes that she wanted to say, but in the shorthand. So I don't want you to miss her code switch for you. And so we will make sure we post that link on the website, so you can go there to pick that up. And we'll also attach some others. And so as we do our outtake, we've met 12 o'clock. I've tried to embed some of the comments that were coming down the side in the questions I was asking. And I want to go around and just say thank you to Alex, and thank you to Dane, and thank you to Ruth.
Thank you.
And if you want to hear more from these folks, I'm going to be interviewing most of the people throughout the symposium separately. And we're going to dig deeper, and you'll have more time to ask questions, and even live. So that's an opportunity. So pay attention for future links. Bye, everybody.
Thank you so much. Bye, everyone.